and I welcome you all here to this press conference for the purposes of a discussion around proposed changes to the Accountable Care Act. It's my great privilege and honor to welcome Senator Feinstein and thank her for her tremendous attention to this, what I would call existential crisis to the country. It's been our privilege to host her for a tour of Benioff Children's Hospital here in San Francisco, and her knowledge of the situation and the issues at hand are quite extraordinary. Many of you know about the University of California, San Francisco, but just a couple of words. We're proud to be a member of the largest and arguably by many objective criteria, best public university system in the world. Compared to our other 9 sister campuses, we are unique with an intense focus just on healthcare and the life sciences. And it's that focus that we're addressing here today. We are proud, because of our public mission, to serve a large proportion of Medi-Cal patients in the state. Benioff Children's Hospital, San Francisco, about 50% of our patients are covered by Medi-Cal. Benioff Children's Hospital, Oakland, more like 70%. And UCSF Health as a whole, about 40% of all of our patients are Medi-Cal. We are proud and honored to serve those patients and their families, but the threat to the financial underpinnings of the Medicaid program is indeed serious and a crisis for the country. To put it in some perspective, UCSF Health subsidizes the care of the Medi-Cal patients that we see today to the tune of about $300 million a year. Any further erosion in support of this program federally would put intense pressure on our ability to continue to provide the services that we are proud to offer our patients and families. And so that's what we're here to discuss today. And to make a few additional comments, I introduce Mark Larrett, who is the President and CEO of UCSF Health. Thank you for being here.
Thank you, Chancellor Hoggood, and thank you, Senator Feinstein. We are so appreciative of what you have done for this city, for this state, for this country, and our world. We're honored to have you here today. The Affordable Care Act was a boon to healthcare in this country, in particular in this state and in this city. Those of us at the front line have struggled for years with the problem of uninsured patients struggling to find a way to get coverage, to get care. And with the Affordable Care Act, we had added millions of new people to Medi-Cal rolls in California. Is the Affordable Care Act perfect? No. Does it have flaws? Yes. But do we want to go back to taking 23 million people who are currently insured as take them off the rolls, as would be the case with the House bill, or 22 million off the rolls as a consequence of the Senate bill? We find this to be really antithetical to what we stand for at UCSF. I think there are 2 misunderstandings, if I can, for those who are developing policy on this. The first is that while many people are dissatisfied with the premium costs for the exchanges and the increases in the premium cost, they do not want to see the exchanges go away. They want them improved, and there are ways to do that. And secondly, I think there is a misunderstanding about Medicaid. Medicaid was once thought of as only for poor people who are struggling around the fringes of society. But today, 1 out of 2 births in this country is a Medicaid birth. Medicaid is your elderly parents in a nursing home. Medicaid, as one person described it, is the Medicare program for the working people in this country, and we really believe it must be protected. We are concerned that some of the discussion is about taking $800 billion out of the Medicaid program nationally, which would have a devastating effect here in California for our ability to continue to provide care, as Chancellor Hoggood says. We are very convinced that more coverage does a better job, improves the care of people in this country. And in our view, there is no better investment that our nation can make is in its people and in the well-being of our people. It's now my privilege to turn the microphone over to Dr. Michael Anderson. Dr. Anderson is a pediatric intensivist. He joined us 5 months ago from University Hospitals of Cleveland, and before that, Rainbow Babies Children's Hospital.
So, Senator, it was great to show you our heroes and our beautiful place. Let's do a little sort of poll, if you will. If you have children, raise your hand. If you have grandchildren, raise your hand. If you are an aunt or an uncle, raise your hand. If you've seen a child in the last 24 hours, raise your hand. Beautiful. Let me be very clear that the bill in front of the Senate today will harm all those children. Not just the children on Medi-Cal, and we all know in California 1 in 2 kids are supported by that important insurance, but this places a testament to how all kids benefit from healthy, robust children's hospitals. We train the next generation of nurses and therapists and pharmacists and doctors. We conduct amazing research, and we were talking about diseases that in Sam's and my career we've seen wiped out, and we're on the progress to wipe out more diseases and make kids healthier. But $800 billion from Medi-Cal will hurt this institution and every children's hospital across this country. So each of the kids that you love or you've seen will be negatively affected by this bill. And I know this country, and we will not let this happen because we have wonderful champions like Senator Feinstein fighting for us each and every day. So we've got a lot of work to do. We can talk a little bit about the plan to get out folks to talk about this, but my one point is kids will suffer if this goes through. And now it's my privilege to turn it back over to Dr. Hallgood.
Thank you, Mike. And as Dr. Anderson said, the real champions of children's hospitals are the parents and the families that support their kids through all of the travails that they have to deal with. And so now it's my honor to first introduce Sally Mcdonald to tell us a little bit of her personal story and Maggie, her wonderful, wonderful child.
Thank you very much. I really want to thank UCSF for giving us this opportunity, and I see many of Maggie's caregivers sprinkled throughout here, and I thank you all again, and will forever, probably. As he said, my name is Sally Mcdonald, and I had the great privilege to be the mother of Maggie Mcdonald. When Maggie was born in 1994, I pretty much had it all. I was practicing attorney in San Francisco, happily married with 2 sons, and living in a house we owned in the city. When she was born with Vater syndrome and had to stay in the hospital for the first 3 months, and then face what we thought would be a year or 2 of surgeries, I knew I could not care for her and my other kids and meet the demands of a legal career. Things changed quickly. My career ended, and therefore 50% of our income vanished with it. Our insurance was through my husband's work, but the lifetime cap, which are no longer around, I hope, was in danger of exhaustion before she even came home. We adapted to our new normal. I figured out feeding tubes and catheters and didn't sleep much. But the ground continued to shift. Maggie's diagnoses kept increasing. At 6 months, she had hydrocephalus. By a year, we knew she had cerebral palsy. She was profoundly physically disabled. She could not eat or empty her bladder without tubes. She could not walk or stand or even sit up. She had surgery after surgery after surgery, over 80 through the course of her lifetime, and recovered over and over and over again. She was tough as nails. We were spending every dollar we had to keep our head above water. We mortgaged the house and tried to keep going. My husband changed jobs to avoid the lifetime cap on the insurance. Things were getting more desperate. Then, when Maggie was 3, she was the first child in San Francisco to get Medi-Cal under the developmental disabilities waiver. Slowly but surely, things started to change. Getting Medi-Cal through the waiver saved us from financial ruin, saved money for the state of California, and most importantly, extended Maggie's life. All of the co-pays for the hospitalizations and medications were paid by Medi-Cal. That meant thousands of dollars each month that we were not having to pay anymore. And we were able to get nurses in the home. I used them at night so I could sleep for a few hours. Her wheelchair and home medical equipment, and there was a lot of it, were rarely covered by our private insurance, but they were covered by Medi-Cal. Maggie's medical issues continued throughout her life, and things got more and more complicated, exponentially so when she had to get a tracheostomy and her care needs went through the roof. Because we had home nursing, we were able to keep her at home. Without that, she would have gone into an institution at a far higher cost to the state of California. I know I have painted a picture of a helpless little girl, and she was, physically. Her medical issues and disabilities were dramatic, but they were only a part of her. This child had a personality as big as anyone and was the life of every party. She was not able to talk, but communicated through a communication device, which was also paid by Medi-Cal. I often said that only I would have a child that could not talk, but could talk back. She told jokes, even appearing at talent shows in school as a sit-down comic. She went to her proms, graduated from Mission High School, and loved to hang with her friends just like every other teenager. She had a wonderful life. Sadly, she passed away very suddenly in 2014, just before her 20th birthday. My husband and sons and I are still trying to find our feet without her. She defined our lives for 20 years, and now she's gone. Statistically, there are very few Maggies, but statistics are numbers, and we are talking about people. That small percentage of the population translates to thousands of children across the state and probably millions across the country. They are pioneers. They are saved by the amazing advances of medical science, and there's no better example of that than UCSF Benioff Children's Hospital. But society lags behind. The system was not set up for the Maggies of the world. Yes, caring for them is expensive. No one knows that better than I. But not caring for them is even more expensive. Her generation was the first to survive infancy and childhood. A generation earlier, she would not have survived even a few days. Because of the amazing medical care she received here and our access to that care, Maggie lived for 20 years. A child born today with the same issues has a chance at a normal lifespan because children like Maggie broke the ground for them. They should be supported and celebrated. This is America. We are a nation of pioneers. Lots of people died on the Oregon Trail, but they made it possible for others to push farther, and we celebrate them in our history books. The Maggies of the world are just as important as Lewis and Clark. They are living lives made possible by medical breakthroughs, but compromised by society's inability to support those breakthroughs. They should not fall through the cracks of society. They should be revered. There is no nice way to put this. Cutbacks to Medi-Cal will be fatal to many children. We encourage medical science. We want the breakthroughs, but we need the support as those breakthroughs continue to develop. There are real people like my Maggie caught in the middle, and they are worth the investment.
Thank you, Sally. And now we'll hear from Kristen Chassett, and she will tell us a little bit about her wonderful daughter, Megan, who will turn 2 in 2 weeks, I believe. So, Kristen, thank you.
Thank you for having me here today. It's an honor to be here, to have the opportunity to speak in front of you, and especially Senator to meet you. Thank you. Megan was born here in this hospital at UCSF on July 23rd, 2015. And she was born with an undiagnosed heart condition and required emergent surgery just 5 hours after her birth. After her surgery, unfortunately, she only got sicker. And so she underwent a second open heart surgery when she was just 4 weeks old. Megan was in the hospital receiving treatment for the next 10 and a half months for various complications and illnesses as a result of her congenital heart disease. She is fed exclusively through a G-tube in her stomach, and she breathes with the assistance of a ventilator and supplemental oxygen through a tracheostomy tube in her throat. We celebrated every major holiday in this hospital, and this was our second home for 313 days. And many of the people in this audience cared for Megan in such loving and wonderful ways, and it really warms my heart to see you here today supporting us in this fight. Megan came home almost a year ago. She'll be 2 in just a couple of weeks. And when she first came home, she couldn't sit up on her own. She couldn't eat or drink by mouth. And worst of all, I think as a parent, is I couldn't even hear her sweet little voice over that tracheostomy tube. Today, her bald spot that was on the back of her head as a result of laying in a hospital bed for an entire year is covered up with beautiful brown curls. She's on the cusp of standing and walking on her own. And she's learning new words every single day, including no and mine. And she is a bold, beautiful, wonderful child. And she is at home thriving in these ways because of the support that she receives through Medi-Cal. Medi-Cal covers therapies that Megan receives in our home. Therapists come to see her 3 days a week to work intensively on speech, feeding, and physical therapy. Megan still has a lot of ground to cover, but the progress that she has made in 1 year has been astonishing. Medi-Cal also covers in-home nurse care, which is the reason why I can be here today speaking to you. Megan has 2 trained nurses who work with her 16 hours a day for 5 days a week. And it gives respite to Megan's father and I. Megan requires constant care and supervision because she is so complex and fragile. And keeping her home and safe would have been an absolute impossibility without Medi-Cal covering nursing care. It would have been an impossible thing for my husband and I to care for her on her own at home. So if we didn't have that critical care at home, Megan would be here in an intensive care unit costing upwards of $10,000 a day. But instead, she is home with her big sister. She is loving life. She is sassy as can be. And she is a joy. She is an absolute joy. And Medi-Cal will give Megan the opportunity to get past her medical complexities and be defined not by her illnesses, but by what she's going to, what she will accomplish in her life. It is unbelievable what this little girl is capable of doing, and I can't wait to see what she's going to do next. Thank you.
So thank you, Sally. Thank you, Kristen, for sharing your stories. Demonstrate the incredible courage of literally millions of families around the country who are doing their all for their children every single day and who require the Medicaid support to let them thrive and flourish. So thank you both for being here. When we were touring the hospital, we also saw many of our trainees at work and recognized that academic health systems like UCSF across the country are training the next generation of physicians, nurses, pharmacists, dentists, and other allied health professions to help support the kinds of families and children we've heard about today. And also saw some examples of where research is changing the face of American medicine and medicine around the world today as we speak. I've been in this business for 40 years and have never been more excited about the potential opportunities for science in changing the kinds of lives that we've heard about today. That science needs support, and it's my incredible honor now to welcome a true champion of healthcare in America, a true champion of science in America, Senator Feinstein, to make a few comments.
Whoops. Thank you very much, and thank all of you for being here. I want to begin just with something that takes me back over 30 years. 2 people walked into my office. It was the center office on the 2nd floor in City Hall. One was Dr. Merle Sandy, and the other was Dr. Paul Volberding. Paul, that was, we won't say, it's close to 40 years ago for both of us. And they told me at that time, the first people ever, the problem was AIDS, and they became essentially the diagnostic team as well as the treatment team that led the way for decades in AIDS. This man is a fine man. In my view, he's a great man. He took a horrible disease and he found a way to deal with it. And if you'd give him a big round of applause, Paul Volverding. And I'd like to thank the three people who spoke on behalf of the University of California here, and particularly this institution, the specialty institution that I think has made such a huge difference. The mothers who in and of themselves are true American warrior women, just incredible. And to all of you, some time ago, the majority leader appointed 13 white men to sit in a back room and write a bill. No one in his party saw the bill. No one in the other party saw the bill. I've been in the Senate 24 years. Never has a bill this big come to the floor of the United States Senate without hearing, without notice, until a very few days, actually a weekend, before the bill was going to be on the floor, it was released. Doctors weren't given a chance to testify. The elderly community was not given a chance to testify. Our staffs were not given an opportunity to read and understand the bill. The process was to jam this bill through on the back of a process, arcane, called reconciliation, which limited to what you could do with it. But it took 51 votes to pass the bill, not 60, which would have been the case otherwise. Well, the bill hasn't come up yet because as Americans become more familiar with the bill, as those of us in the Senate become more familiar with the bill, we see what this bill is, and it must be defeated. To start with, it takes $772 billion of Medicaid. It breaks the back of Medicaid over time, and it puts it in a special fund, most of which will be used for tax cuts for the very wealthy in this country. How very sad. And I know not one person that would ever want a tax cut based on the health of a child or the health of an adult. And so what the children's hospitals have given to me is a look at this new sophisticated world of intensive medicine, which has been so special in the life-saving of youngsters all across this state. I was in Fresno not too long ago, where 3 out of every 5 nursing home beds would be affected by this Medicaid cut, where 50% of the people of the county depended on their health care from Medicaid, to here. And if you look at the big figures of who receives their health care through Medicaid, it's pretty critical. 1 out of every 3 people in this state, 14 million, receive their health care from Medicaid. Now, what the Republicans have done essentially is says, okay, we'll pass the bill now, but these cuts won't go into effect for a couple of years. So it's a little tricky. You get past the next election without a cut. And then the cuts come home to bear. You figure it out. Most of these institutions up and down the state, the great children's hospitals, which are sort of the new discovery from the time I was a small child, when the only one, I guess, was Shriners Hospital. Now UC has one here, has one in Oakland, there's a Valley, there's one in Los Angeles, and it goes on. And these hospitals are able to provide state-of-the-art care to every child. This is the way medicine should be, that everybody's got a chance. And you've heard from 3 great mothers this morning. I mean, I've listened to their stories, and each one of them, they're incredible. And they've lived their lives full of love and caring and dedication. And I think the American people want that love, caring, and dedication. But if we allow Medicaid to be cut this way, this hospital will have to begin to plan what they will do as Medicaid winds down. And for some of these hospitals, where the Medicaid amount is 75%, they will likely lose the hospital. So understand that this is real, that it's happening now, and that we must stop it. And I think let me just give you a few facts. 1 in every 2 children are covered by Medicaid. That's 5 million in our state. 3 in 5 nursing home residents are covered by Medi-Cal. 1 in 2 people with disabilities. 1 in every 2 people with disabilities are covered by Medi-Cal. In Los Angeles, 40%. That is 4.1 million people covered by Medicaid. San Diego, 28%, Sacramento, 37%, Fresno, 1/2 of the population, as I said, and in San Francisco, 27%, or $230,000. So this is a huge problem. What I'm asking you to do is get on your computer, get on your phone, and call as many Republicans as you can. There is no Democrat in the United States Senate that will vote for this bill. It will be 51 Republicans or nothing. And I think we're very close to defeating it. We're very close. Mitch McConnell, the leader, hasn't brought it to the floor. My sense is he won't until he has the votes, and my sense is that he's not going to have the votes. This has been real. Senator Kamala Harris and I did a press call. We thought, it was a conference call with people from the medical community. We had, I think 100 people that we thought would be on the call. There were 400. It ended up with the email campaign that went on that 800,000 people were reached by that call and mobilized. If you can do something like it, please do that. Do that with your friends. This is really serious. America has never been in a position where it could do for these 3 children what it has just done. And it's here, and the funding is here. And the medicine practiced has shown you can extend life. You can do what everybody says they want, is to give a child a chance to live. And these hospitals do that. So I'm just here to urge you to help us. I go back Sunday. We'll see if it comes to the floor on Monday. If it does not, you know that it does not have the votes yet. So what I'm asking you to do, you will make a difference in. Go to your phone book, get Republican names, make that call. Someone will answer. Tell them how strongly you're opposed to this. Write letters. Mobilize whoever you can. But let's defeat this bill. Are you on board? Yes. Will you help? Okay. Thank you very much. Thank you,
Senator Feinstein is on a tight schedule, but she does have time for some questions. I know there's a lot of UCSF people here, but I would like to take questions first from any press that are here, and the questions should be limited to the healthcare situation. So any questions first from the press? Yes. Here in the second row.
Yes.
Melissa King, Channel 5.
Hi, Melissa.
I wanted to ask you, you were one of the senators who signed a letter saying that you'd be willing to work with the Trump administration on improving the stability of the individual insurance market for the current situation. What are the Democratic proposals for doing that, and have any Republicans reached out to you to say, let's work on that?
Well, let's talk for a minute about the individual market, because one of the distinguished doctors mentioned it. This is when you alone go out to buy a single policy, and you buy that policy, and that policy is covered with a subsidy up to 400% of poverty, which is about $47,000. So you get a supplement if you earn under $47,000. The minute you go over that, let's say it's $50,000, you lose the subsidy. And I'm told by Covered California, Peter Lee, that to get a policy today would be $800 in San Francisco. That means that you'd be paying 20% of your salary for health care. Obviously, that's too much. So what we've done, this is what we call the cliff. What we have done is taken the cliff and changed it into a percent, so that as you earn more, the cliff goes down gradually. You don't just fall off of it. Now, Republicans don't want to spend any money in this area to be helpful. This is a market of about 2 million people, but it's the market where we have gotten the most calls of high premiums. So this is one way of handling that, and we believe it's workable. We've been working with Covered California. I've introduced it as a bill. With this crowd, I don't think it'll go anywhere, but it's there.
Question here and then in the back.
Senator Feinstein, Angela Hart, Sacramento Bee, you made comments that this is beatable. Beyond what you've asked people here today to do, how is this beatable? What is the strategy? If you could talk about the politics of that, and how long could this drag on?
Well, it's beatable because of what they do. They allow the essentials, the premium essentials, to be changed by state. So, for example, a state could elect not to cover maternity care. We've tried to and defund Planned Parenthood, which in many places in our state, too, is the only funder of women's health care. So they made a number of changes. And I'm trying to remember with specificity exactly what it does. There are 10 preconditions. Those are all right, but the essential benefits is what the problem is. And under Obamacare, you have to maintain these essential benefits. A state could cut out these essential benefits, and so you could end up with a premium that would be a junk policy premium.
Okay, so that's how it would be. How does that work? How does that fit into it being beatable?
How does that fit into it being beatable, the bill? Oh, it's everything together. It's the Medicaid cut, it's Planned Parenthood not being funded, it's maternity care not being funded, it's how the bill is going to affect Americans, because you take the federal money out, which is what it does, and use that federal money for tax cuts. That's the big thing. That's money that will be gone in tax cuts, and that's $772 billion. That's the Medicaid money.
In the back there.
Hi, John.
In a related matter, what's the status of the Children's Health Insurance Program, which is coming up for renewal, and I understand that the Republicans want to make some changes in that?
Yeah, I can't answer that. I just don't know where that one is. I can find out and let you know. Ashley will give you a call. John Willermuth Chronicle. Okay. I can't understand him.
It's about national, we're restricting this to just healthcare, thank you. Yes, they're in the process. Could you introduce yourself?
Oh, my name is Ruben. I'm with the KKPA Evening News. I was wondering, if the bill fails, to pass the Senate, what is collaboration between, what would the two parties collaborating look like for you if the Republicans?
We would collaborate. Chuck Schumer has said that. He is the leader on our side, and we would sit down and collaborate. I would find it very difficult to support any bill that did not have an open hearing, and that there was not an opportunity for people that had need to come before the Congress and say, look, this is good and this is bad, and here's why. We've had none of that. We don't know what doctors think. We don't know what anybody thinks about the bill that's a group and organized. Nurses, you name it, we don't know. And that's because there have been no hearings. Well, we do know because some have written letters, but most, the positions are unknown.
Take one more question if there is one.
Okay. I can't hear him.
I'll speak up. This morning on your Twitter page, there was a tweet that said that this bill was immoral. Can you expand on that, on why you feel that this is immoral?
Listen to these three women. Their children would have been dead. I mean, I heard enough to just know that. They had an opportunity to see their children thrive for a period of time. They had an opportunity, to live the life they had, as one said to me. That's a very important thing. And so it's helped improve medicine, and the improvement in medicine has helped the lifespan of chronically ill children as well as adults.
So with that, let me ask you all to join me in thanking Senator Feinstein.
Thank you, everybody. Thank you.